Hello, this is the charting orientation for skilled nurse visit note. You're going to be going to hallway.devero.com. It'll take you to the login screen here. I'm going to log in. You will go to your patient. So for the training, it's test patient. And then you'll be going to skilled nurse visit note right here. The skilled nurse visit note is a note for your entire shift. So if you're working from 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m., you'll put your whole allotted time here. So this will be for 7 a.m. to 7 p.m. So your skilled nurse visit note is basically a head to toe assessment, and you're going to need to fill out as much as you can. So all of this right here, all your vital signs, all of this needs to be filled out. Going through pain, all self-explanatory. It's gonna be faces or numeric. If it's numeric, you need to put the numeric pain level here. Or over here, if it's gonna be faces, you need to choose which nonverbal indicators of pain they are having or experiencing. And then you can choose the level of pain. Integumentary, so you're going to go through here and select what pertains to your patient. If the patient has a wound, you need to select yes. Also over here, you need to put where the wound is. And then since you use wound number 1 right here, you need to go into wound number 1 box and state what the wound is. What type of wound it is. And then go through all through here and state if you provided care. If care wasn't due today, then you just select not due today. And you can also state in the comments, wound care not due today. Or if it was, then you need to state how the patient tolerated the treatment. So you can state what you did, and then you can also say patient tolerated treatment well. And you'll be going to the bottom and going to hit save. Hitting save takes you to page 2 of your head to toe assessment. So cardiopulmonary, you need to go through this box and select everything that pertains to your patient. Same with breath sounds. If everything's all clear, you can just select all clear. If not, if you hear crackles or wheezing or diminished lobes, then you can put X's in here, wherever you like. Going through here, same thing, whatever pertains to your patient. Same for these boxes, or say the catheter. Even if they're not having any of these problems, you still need to state what the color and consistency of the urine is. Gastrointestinal, you need to go through here, you need to state when the last bowel movement was, what was the consistency, what their diet is, how their bowel sounds were, and then any other problems that they might be having. You need to state how their appetite was, if they're having difficulty swallowing, and then this is for blood glucose monitoring. Here, if they're alert, oriented to person, place, and time, if they're forgetful, if they have swallowing or speech difficulties, if they have dysphagia, or if they have, if they've had a laryngectomy, then those would be swallowing or speech difficulties. Musculoskeletal, if they have abnormal gait, abnormal balance, then you need to state why they have this abnormal gait or abnormal balance, or what it looks like. So if abnormal gait, my patient has shuffled gait. And abnormal balance, he has unsteady balance upon standing and ambulating. How their grip strength was, strong, less strong, assistive devices. He uses a cane and a walker, and he does have weakness. Anything that pertains to your patient, you need to be putting in here. Homebound status. This is for this is for stating why your patient cannot leave home. So you need to go into the templates and select homebound status, and then select which one pertains to your patient. The best one to use has a medical contraindication that prevents patient from leaving home. If you double click inside, you can state their diagnosis, their covered condition. So whatever their diagnosis may be, we can just say malignant neoplasm of colon. And then you'll go down to the bottom and insert to form. There it is. Has a medical contraindication that prevents patient from leaving home, malignant neoplasm of colon. For interventions and goals here, you can just state in these 3 boxes, see SOAPy notes, because you'll be talking about interventions and goals in your SOAPy notes. And you can just copy and paste those into these other 3 boxes. But your homebound status must be, you must insert a template into homebound status. Going down, a supervisory visit, case managers will be providing the information for supervisory visits only. Care coordination note, if there was any change to the plan of care or spoke with the doctor about the plan of care or new medications or change of condition, you'll be filling this out. So what it was about, who you talked to, so it was physician, case manager, and you, the skilled nurse, and then what were the details of that conversation. Discharge planning, click on the red discharge planning. And for discharge planning, it's going to be no plans to discharge, patient requires ongoing care. That's what you will be inserting into the discharge planning. There it is. For plans for next visit, you need to fill out assessment, teaching, and if there was treatments or procedures or therapy. So assessment would be, for your next visit would be, you're going to be performing a head to toe assessment. This needs to be in there, the head to toe assessment. If you're going to be doing any other assessments, then you can also state after the head to toe assessment. For teaching, this is going to be what you're going to be teaching or educating the patient on at your next visit. So this can be on disease process, oxygen therapy, nutrition, medications, hydration, anything that you're going to be teaching or providing education on. Falls or risk for falls, anything that you're going to be providing education on. Treatments, this is for, wound care treatments, trach care treatments, anything to do with treatments or procedures or therapy. If they don't have any treatments, procedures, or therapy, you do not need to fill it out. And then this is for if you know the upcoming doctor's appointment, then you would put the date and the reason for the visit. And so if you are all done with your skilled nurse visit notes, the end of your shift, you can go ahead and send to the office right here. But if it's not the end of your shift and you might have some changes to do to your skilled nurse visit note, you just select save. To get back to your skilled nurse visit note, because it's the end of your shift and you need to send your notes to the office, you just go to patient chart right here. Scroll all the way to the bottom because that's where your notes will be. Under SOAPy notes and skilled nurse visit notes. Here's mine right here. And I'm ready to send it to the office because my shift is complete. Scroll to the bottom, hit send to office. If you scroll down again to find your note at the bottom of the chart, you'll see that it's now blue bold. So blue bold means that it is sent to the office. You can see the date, your name, and right here it says sent to office. So you have successfully sent your skilled nurse visit note to office.